Okay, this is my discussion portion of my dental trophy. In case I need to show you this, this is my OCCI certificate. Get that out of the way. Update on that dog that I had done this morning. That tooth, the more I looked at it, and I actually went back and scaled it with a hand scaler a little bit more, after I was able to remove more of that calculus, I noticed that what he had was more of a slab fracture, as well as a little bit of tooth damage. I don't really know how to describe it other than a cavity. I mean, that's exactly what it was a cavity in that subgingival region. But Dr. Miller took a look at that tooth, and she said that since the tooth is so secure in the gum and in the root and all that, she felt that it would be best if she just left it alone and let it do its thing, regardless of the cavity and the slab fracture. On the other side, on his right maxillary and carnassial tooth, he had another slab fracture. And more uncommonly, he also had a slab fracture on his, I think it was his third or fourth premolar. No, yeah, third or fourth premolar on his right mandible. Anyway, but all of his teeth ended up being really pretty decent condition, considering the amount of dental disease that he had, and gingivitis. So we ended up not pulling any teeth, so that's actually a good thing. But this is what I have today. Hopefully I can explain this a lot better than what I had done in the past. I actually have the video discussion paper, so that way I can make sure that I cover all my bases. I hope that's okay. It's not like it's giving me any answers. So, and then I also have a blank sheet of paper, so that maybe I can I have more of a memory where if I see things, I'm able to explain it better. So maybe I can explain it better. The dental, what was it called? The dental formula for dogs and cats. Maybe I can write it out. And then I also have a canine dental chart and a feline dental chart. I think I had that on the last video that I had done. And I'll zoom you in so that way you get a better view of what I'm doing. I have all the tools that I used today. And I will take pictures of these so that way you have a better focused view of what it is that I used this morning. Because my camera, while I just got it in December, it is still, for some reason, the focus on it is not very good. I don't know why. It didn't drop it or anything, but for some reason the focus on it just went to crap. So, I will take pictures and send that in. And this, maybe to help me out a little better, are dental radiographs that I took at another facility for another class that I had to take for radiography, so that I can kind of explain. Maybe it'll help me a little better to show you what I'm talking about. If I need it, great. If not, I won't worry about it. But, and I also have a toothbrush, a dental treat, dog toothpaste, well, dog and cat toothpaste. And then I have my little cat model to show you the different teeth. So, let's get started. We are on call tonight, so you might hear the phone ring a lot. So, I'm going to show you the different types of teeth that I have on my model or diagram. So, zoom you in. Alright, have here is on this side is the the good teeth. This is the bad teeth of this cat model. So on the good teeth side, what we have are, let me get you in frame. We have our incisors. Whoops, yeah. Maybe I can do this better. Incisors. We have our canine teeth, these two. And then we have our premolar and our molars. And same thing on the bottom. Incisors, canines, premolars, and then molars. I don't have a dog dental model, so all I have are pictures. But for a dog, you have, I don't even know if you can really see this, but you have your incisors, your canines, your premolars, actually, and this is where I get really confused sometimes. That fourth premolar on the top, or on the maxillary, are always going to be your carnassial teeth, always. And then you have only two molars on the maxillary. And then on the bottom, on the mandible, you have your incisors, canines, premolars, and on the mandible, you have the carnassial tooth is the first molar. That is where I always wind up getting very confused. And so, and then you have your second and third molars as well. So dogs have quite a lot of teeth. I think it's like 42 teeth. But anyway, and then you have going toward the front of the mouth, or rostral, is going to be mesial. If you're going toward the back of the mouth, you either say toward the back of the mouth or distal. On the outside of the mouth, where the side of the tooth that touches the cheek or the lips, would be considered the buccal side, the side of the teeth that touches either the hard palate or the soft palate. On the mandible, or not mandible, the maxillary, are going to be considered the palatine side of the teeth. On the mandible, it's a little different. On the side that touches the lip or the cheek, it's going to be the buccal side. And then on the side that touches the tongue, it's going to be the lingual side of the tooth. So that would be one way to discuss or differentiate the different sides of your teeth. But you have to, usually if you say, hey, the lingual side of this first molar, usually that's kind of self-explanatory, that's a mandibular first molar. So you should, ideally you shouldn't have to be like the first molar of the mandible on the lingual side. That's kind of a little longer than what you really need to say, just the lingual side of the first molar. Usually, if you know your stuff, that goes without saying that it's the mandible. So those are the different teeth. And the different surfaces of the teeth. The dental formula for dogs and cats. Let's see if I can remember this. Here's my paper. Here's a blank piece of paper. I don't know if you can see it. It's blank. So ideally, for dogs have 6 incisors top and bottom. I'll be honest, I'm not quite sure as far as what you're talking about as far as the canine and feline dental formula. I do know the Trident system, and then I think this is the canine and feline dental formula. But so the Trident system is the maxillary right, maxillary left, mandibular left, mandibular right. So 100s, 200s, 300s, 400s. If it's the first maxillary incisor, it would be 201, and from there it goes on back to I think 209. I'll have to double check that. But the formula for dogs, they have 6 incisors on the mandible and 6 incisors on the maxilla. So you would say I for incisor, 6/6, and then I think that I'm doing that right. And then canine, which is C for canine. I don't even know if you can even see what I'm doing. 2/2, and this is the adult formula. Premolar, so you say P for premolar. They've got 1, 2, 3, 4 premolars on the top. So 4/4, and then M, 2/2. And then yeah, I think that's right. And if I remember correctly, they're for puppies, it's actually not a lot different. I think maybe the only difference is that they may have 3 premolars as puppies, if I remember correctly, than they do as adults. Adults, I think that they just they come up with 1 more premolar. And then for cats, they have same thing. Incisors 6/6, canines 2/2, premolars they have, let's see, I'm trying to think. I want to say 3/. I think it's 2/3 in cats, and their molars, they have 1/2, I think. I think that's right. So, incisors 6/6. I always have 6 incisors, top and bottom. And then canines 2/2. They will always have 4 canines total. Premolars 2/3, if I remember correctly. And then molars, I think they have 1/2. I can't remember exactly. I know I should know this, but honestly, I remember better if I have a picture in front of me. Okay. Yeah, that's right. So 1, 2, 3. Okay, so I was right the first time. They have 3 premolars up top. 3 premolars up top, and 2 premolars on the bottom. So I had it backwards. 3 over 2. 2 premolars, and then 1 premolar, top and bottom. And I want to say that essentially as kittens, it's the same, with maybe minus 1 molar, and I think it's the maxilla that they don't have yet as their while they're kittens. So I'm going to rewrite that. Adults. For incisors, 6 over 6, canines, 2 over 2, premolars, 3 over 2, molars, 1 over 1. Right there, adults. Incisors, 6 over 6, canines, 2 over 2, premolars, 3 over 2, molars, 1 over 1. Now for the instruments that I use to remove the calculus, the ones that I had used before in my other video were much larger than this, and they were technically dental extractors. They had kind of like a right ankle forcep portion of it, and I mean, ideally, yeah, we usually don't use those to remove any kind of calculus, but that particular day, like I said, we have a satellite office. That particular day, one of the other technicians took these, the good calculus removers, and I could only do what I could with what I had. Otherwise, I normally would not use those. This is what we have. So, now as far as, so what we would normally do, we would start out, for a dental, you would look throughout the entire mouth, the entire, like the neck, check their mandibular lymph nodes, their prescapular lymph nodes. It's a little lower than really you ought to go, but if they're palpable, you should say something. Same thing with the mandibular lymph nodes. And then check under their tongue, check in the roof of their mouth, check their hard palate. If you can see their soft palate, yeah, go ahead and check it out. Just be careful because your animal is intubated, so if you're going to be checking that far in, make sure that you're being careful with your endotracheal tube, so that way you're not pulling it out or pushing it too far in into the trachea, because it's supposed to only go to just before where the bronchi bifurcate. So any further than that, you don't have it far enough in, and if you pull it out, it's not far enough in. Plus, you're causing a little bit of trauma to the trachea. If you end up pushing it too far in, again, you're causing a little trauma to the trachea, and you could be pushing the endotracheal tube into one of the bronchi where it bifurcates. That's not good. That means only one lung is getting the oxygen and the anesthesia that it needs, whereas the other lung is not being properly oxygenated and anesthetized, and it's full of problems. Okay, so if you're going to look into the soft palate, you can, but just be careful. Look under the tongue, make sure that you don't see any kind of sores or any ulcers or anything, any kind of masses. Check the gums to see if there's any kind of gingivitis. I mean, you see here, this is clearly inflamed. Like I said, this is our really good model for cat teeth, to show, a little dusty, to show gingivitis, a lot of calculus buildup. I don't even know if you can really see that, but yeah. So once we check out the mouth, then we would take the extractor, the calculus removers. And essentially what you're going to do is you're just going to, on either side of the tooth, I don't even know if you can see what I'm doing. Let's see if I can. Maybe I can. Give me a second. Let me move this way. Okay. Trying to get you zoomed in. Hang on. Okay. I think this is as far as you're going to zoom in. Alright. I hope you can see me. My camera looks like it's doing something weird. So essentially what you would do is take your extractors and you're going to kind of grasp on either side of the tooth, just super gingivally, so that way you're not accidentally grabbing any gingiva and causing any trauma to it. It's already very sensitive with the fact that there's a ton of calculus up under there. It's really inflamed, it's really swollen. So what you would do is just kind of, just before the gingiva, kind of grasp and kind of pull downward in a gentle motion, just until, so that way you can kind of crack it off. It doesn't take a lot of force. If the tooth is already in pretty bad health, it's going to be really loose, and I mean you're going to know if it's something that the doctor really needs to be looking at, to make sure that you don't accidentally break off this tooth. That's not the whole idea behind this is to make sure that you don't cause any more damage than what's already going on here. There have been cases where somebody goes in for this loose tooth, knowing that it's loose, and go in and try to crack this calculus off. I've seen it before, and they end up breaking the whole tooth. Well, this is a 3-rooted tooth. That tooth usually requires periosteal elevators and dental elevators, and sometimes you have to drill the tooth in half so that way you can make sure that you get all of the roots, just because it's such a large tooth. If that tooth breaks and you're not even sure that you have all the pieces of the tooth, you're in for a big old mess. So you need to be gentle, especially if you already know that this tooth has dental disease. So grab it gently please, and just kind of crack that calculus and pull, so that way you can kind of just remove it. It's really all you need to do. And same thing around here. It's really all you need to do. It's really all. And you're not trying to remove any teeth, you're just trying to remove the calculus around it. So, once you do that, let me try to find what I would use to kind of... Alright, so this one is the one that I would use. I don't even know if you can really see it. It's a really bad focusing. But this has only one side that's got a cutting edge. Only one side. So this is what I would use to clean subgingivally. So what I would do, after I've already cleaned it up, just kind of, we're going to use this clean side now. What I'm going to do is I'm going to kind of push the gum line up and then just kind of scrape downward. So that way I'm getting all that dirt and debris and calculus and plaque and all that out from under the gums. And it has a little bit of a point, so you don't want to stick your point up in there. That's not what you want to do, because that can cause a little more trauma. We don't want to do that. I don't even think you can really see what I'm doing. Sorry about that. But that's essentially what you're doing. And I would do the same thing on this side. Kind of sweeping motions. Just to get it out from under the gums. After that, if there's any other plaque or anything like that, I got this scaler or curette. This is more of a curette. Actually has 2 cutting edges. Again, I don't even think you can see this very well. Again, I'll take some pictures of these so that way we have a better view of what we're talking about. I would kind of clean out anything super gingerly. Again, I'm doing all this where you can't see what I'm doing. Okay. So I would just kind of clean this out. If there's any teeth between, I would just kind of like stick this between the teeth and just kind of go downward. I'm not going to be digging up into the gingiva. That's not what you want to do. So just kind of keep it parallel with the tooth so that way your cutting edge is actually doing its job. And you're just going to clean up the tooth itself. And the same thing with these little incisors. You're just going to kind of clean it up. After that, there is one, we would polish up the teeth. Or no, let me back up. You would use the hand scaler, the ultrasonic hand scaler, and just clean it up. Kind of keep it parallel with the tooth. Usually you don't want to try to use the tip of the hand scaler just because the way the hand scaler works, or the ultrasonic scaler works, it kind of vibrates. And at least the one that we have does. And because it vibrates, it tends to create a little bit of friction. And that amount of friction will create some heat. So you don't want to stay on that tooth for any longer than 10 to 15 seconds because you can create some pulp or damage because of that heat. And that could potentially cause that tooth to die over time because of that damage to that pulp. The pulp is what supplies the nutrition and the blood supply and all that to the tooth itself. So no longer than 10 to 15 seconds. After that, that would be when we would polish up the teeth with a little Profi cup. That you usually don't want to stay on for any. I have been told several different things. I have been told no longer than 5 seconds. I have read differently. I think in my video earlier I said 10 to 15 seconds, but it's usually about 5 seconds, and that's what I try not to do. Because, again, it is rotating, and you want to usually do it at a low speed, but because it's going at such a high RPM, you usually don't want to keep it on the tooth for longer than 5 seconds, because again, it can create heat. You can cause damage to that tooth because you are staying on that tooth for too long trying to polish it. We're trying to create good here, we're not trying to cause more damage. So, after you polish the teeth, clean them up with your water sprayer, and go back and look at your teeth again. Make sure you didn't miss anything. The one thing I do not have in my office that is available to me is a gingival probe. That is what I do not have. I have different curettes and hand scalers, but I do not have a gingival probe. What it looks similar to is this accurate. I don't even think you can see it, but it's similar to this in the fact that it's usually at a right angle, and it is much longer. And it does not have a point. It has more of a, it does not have like a sharp point. It just comes to kind of a blunt point. And it is graduated with little lines on it for millimeter measuring. And I'm not sure why we don't have it, but we don't. Otherwise I would have done this for my patient in my video earlier, but we just do not have a gingival probe for us to measure the gingival depth of our patients. I don't know why we don't have one. My doctor, who owns the practice, is sometimes, you question him and then he questions you back. I'm sorry, but that's just how he is. So, we don't have one. But essentially, we're going to pretend like this is one, a gingival probe. But essentially what you do, I'll turn this where you can kind of see it. Essentially what you would do is just go subgingivally and measure the depth of the gingiva and see what kind of gingival recession you have in each tooth. And that is what you're going to do. There is actually one little nubbin of a tooth right here. That's premolar. So you would measure the depth of that one as well. Every tooth, you would measure the depth of it. And same idea for each tooth. You can see what I'm doing because I keep coming out of the camera. But like I said, you would measure the depth. And I know that this is not a gingival probe, but I do know how to use one. We just do not have one in my practice because, for whatever reason, my doctor has not purchased one. I don't know if he thinks that it's not necessary or if he just so set in his ways. I don't know. But like I said, you question him and he questions you back. So. But that would be how you would use a gingival probe. Those are the different tools that we have. And you're asking, why is dental radiography important? Dental radiography is important because the way it was explained to me is that, let me get you zoomed back out. I'm probably going to have to zoom you back in a second. But the way it was explained to me is that, we can see the outside of the teeth all day long. We can see somewhat the health of that. Like you can see that my teeth are, just from looking at them, are fairly healthy. So, the reason we do dental radiographs is so that way we can see the health and the integrity of the bone surrounding the tooth and the tooth root. We see that an animal has gingivitis. We see that the animal has periodontal disease. Well, we want to know to what extent does that animal or patient have periodontal disease, and we want to know, well, since they have gingivitis, like severe gingivitis, and they've got like gingival recession, we want to know, well, if they've got gingival recession, how much of that bone is being lost as well around that root. So, let me see if I can't find one on this dog. This dog's teeth are this dog is actually the pet of these radiographs of a certified veterinary orthodontist, I think you would call it. I'm not sure. But he is certified, and he is, like, people get referred to him, and that was who taught me how to take these radiographs. And while they're not the best, he says, pretty good considering it's your first time. So, I took that as a compliment. you can actually see that. So let me find a good one. Alright, we're going to go with this one right here. So we can see that this is a mandibular, I want to say this is a premolar? No, this is a, which one is it? Yeah, it is a mandibular first molar. That's what it is. Mandibular first molar. Let me get you focused back in. So, we can see the root on the outside, or the crown on the outside. We know what it looks like. We know that, it's got some plaque, but it's got a little bit of calculus. We need to clean it up. Well, you see that the animal has a little bit of gingivitis and a little bit of gingival recession. Well, how much does it have as far as the tooth, as far as the mandible goes? Well, we take an X-ray of it, and we see that the root itself looks very good. We have a little bit of white right here. You can see sometimes you would say that's a little bit of, if it were, let me rephrase this better. If it were really dark right here around this root, that means that root is having a lot of bone loss. That root is no longer very attached to that mandible, which means that tooth probably has something going on, whether it be periodontitis, periodontal disease, or it's no longer just being kept in by the mandible. It probably needs to come out. But there's actually a lot of white here, and that's actually probably just radiographic artifacts, just because this is my own poor radiographing skill. Like I said, it is my first dental radiograph. All of these are my first dental radiographs, so these may not be the best examples, but and the reason why a lot of these don't have a lot of the crown is because that's what Dr. May told me to do. He said that you see the crown, you know what the crown looks like. You don't need to see the crown in the X-ray itself. You want to see the root and at least 3 millimeters past the root. So that's what I did. But we see that everything looks very good in this first premolar. There is no there is no bone recession. There is no loss of bone. The roots are actually in very good. You see a little bit right here where that's starting to come down, just a little bit. Considering that this dog is about 10 years old, I think is what he said. This is actually really good. And you can see the same thing over here. Actually, I don't know if you can see that. Same thing over here in these last molars. See, there's part of that molar right here. These last 2 molars. They're actually looking very good. Even though there's a little bit of recession, considering she's about 10 years old, that looks fantastic. So we know that she's just starting to get a little bit of bone loss just around where the, oh goodness, what is it called? Where the gingiva meets the crown. So that would be, but the whole importance of of dental radiographs is so that way we can see what's going on beyond the gingiva, beyond the just the crown, beyond, like, we want to know what's going on, not just the root, but the bone itself holding the root. What else do we have? Alright, so calculus. Calculus is essentially just plaque and dirt, food, debris, what have you, whatever that animal has probably consumed in the past, however long, and it's just built up on those teeth. And usually you would see it more on the molars and last premolars, just because that's around where the, about here, around where the, what is it called? Salivary glands are going to be, and all of that is just going to help keep bacteria in that area. It just kind of sits there and festers, and it's just not good for the teeth. I mean, we have it going on too as humans. And about here, that's where our molars are, and that's where our salivary glands are. And usually our teeth are actually, they usually have a good bit of plaque right there. And even though we brush every day, it's not perfect, but it's just not good. It just sits there and cakes onto the teeth, and layer after layer after layer, and it just turns into like this cemented on there's really no other way to describe it. Plaque. It's just caked on, cemented on, years of layering of food and dirt and bacteria, really. It's just a big old hunk of bacteria in food. That's essentially what calculus is. It's disgusting. And quite satisfying to break off teeth, by the way. Periodontal disease is disease of the periodontist. Periodontist? It's periodontal, I mean, if you break it down, peri meaning like around, dontal, the teeth. So periodontal disease is disease of the gums around the root of the teeth, around the bone holding the teeth, whether it be the maxillary or the mandible, maxilla and mandible. If you ever hear anybody saying dental disease, it's essentially the same thing. Periodontal disease, dental disease. You see gingival recession because of it. You see severe gingivitis. You see, in some cases, you see oral nasal fistulas, which I'll get to in a minute. You see things like what is it called? See root recession, bone recession rather, not root recession, bone recession. I think I've already mentioned gingival recession, but it's just bad news. It's usually irreversible. All you can really do is just